Hello everybody, it's SuffolkBlue, all the way from merry old England. How the devil are you? I hope you are well. Welcome back to Big Pharma, the corporate pharmaceutical strategic game. That's the sort of game it is. We're going to carry on. I don't want to do any more challenges though. I want to go straight into a custom game, I think. Let's have a look here. Competitors, we want to have a competitor, random, or we'll put a random on. We'll put them on normal. Up to ocean, we'll have lots of ingredients. Number of starting 2, catalyst 5. Yep. Now I don't want to put any victory conditions, and I still want this a bit of an open plan. Or maybe we could put a revenue in. Let's say our revenue is the first to 15 million. Map size, let's put that up to 4 to 4. Event frequency normal, loan interest rate is normal, plot cost normal, speed normal, salaries, everything else is normal as per normal. Starting loan none. Cure rate 100%, infection rate done. I think that's pretty good. Start game. Okay, who are we going to be? Well, I've already had a go at this, so of course I brick came last time. I'm going to look at that. Let's have a look. We could be V for Viagra. Why not? V for... No, we can't. V4V. V4V Chems. There we go. We could be Penny. We could be Barkley. He looks a bit stern, doesn't he? Leonard looks like Rolf Harris with white hair. I quite like Orion. We'll stay with Orion. Silly name, really, but let's go with it. Right, so this is our starting place. Let's freeze and have a look. We've got to earn over 15 million. That is the objective. You can see that we've got 50,000 to our name. Let's have a look at our company detail screens. New screens, you've not seen any of these. I have seen some of these. So at the moment, we've got our competitor is Cooperative Care. There it is. We're V4V Chems. That's Cooperative Care. They haven't made anything yet, neither have we. Let's have a look at our starting ingredients. You can see all of these are down here, look, and we can't do any of those yet. We have bruised amlysso quartz, which causes fatigue but also relieves hypertension, and we've got shimmering Marox crystals, which causes pins and needles but also can treat diabetes. But as you can see, this one costs less to import per unit. That's 41, that's $35. We haven't as yet gone anywhere. We'd need some Indiana Jones people to go and find these particular ingredients out in the forests, which we've already got. These are deserts. We would need to research deserts before we would go there. This is Arctic. This is underwater. That's Arctic as well. So we would need to research all of those locations before we could send anyone. So really, I think the best thing for us to kick off with is probably this one. It's the cheapest one per unit. It also treats diabetes almost. So let's have a look at our production. Let's have a look at our cures as well. So this will tell us at the moment all the different types of ailments, if you like, that's out there that we can attempt to heal. We're going to look at body response. So we're going to start this one with 105. We can look at the numbers of people who are suffering from diabetes in this game simulation, 1,222. There's no cure being provided yet from anybody, and hopefully we can get in on that. This is our research screen, and you can see here that we as yet have not researched any of the areas. It goes all the way up to the top and all the way down to the bottom, and what we really want to start potentially is getting down towards the patents down the bottom here, which will allow us to protect the drugs that we have. Unfortunately, we're going to have to go, well, let's hire one anyway and get him on the case for national headquarters, because we're going to need to start that off anyway, and we're already using 3,000. We haven't even started anything yet. So let's do an import job. These are our import and export terminals, if you remember from last time, 3 in and out terminals. Let's start here and let's import in some of these shimmering Mercurox crystals, which will help with diabetes. Let's do that.
Insufficient upgrade points.
So we're now... Oh, I didn't click upgrade. Upgrade is to make the cheaper. We don't want that. We want import. There we go. So now we're bringing those in. The first thing to look at is, let's get one of those out. Well, hang on. Let's unpause really quickly. There it is. So this is one of the crystals. We can look over it. We can see that for removing this, we need to get it to 3 and 4. Now currently we're on 6. We need to reduce it to by 2 to be able to remove the pins and needles. So in order to be able to remove it, we want to decrease the concentration. So we're going to use a dissolver to do that, and we can do this pretty simply this way around. That's going to cost us a little bit of money, but never mind. Let's put another one. So that's down by 1. This is going to be down by 2. And that will take from 6 to 4, and at 4 we would be able to remove it again with a further dissolver. So let's put another dissolver on here. Makes a really nice straight train. Now when it comes out of here, hopefully what we will see is it still treats diabetes, and it actually will be reduced to probably the middle of this range. So 1, 2 and then 3. So 1, 2 and 3. So it should be slap bang in the center here. It may not be optimal strength. We don't know what the optimal strength for this drug is at the moment because we don't have an analyzer, and we'd have to research analyzers to be able to find that out. So we don't have that at the moment. But what we can be sure of is when this comes out of the end here, it's going to be absolutely ready to pill and process. So when it comes out, let's get ourselves a pill printer, or a couple of pill printers probably on the go, probably here and here. Let's join those up and send them out, and then join that up and join that up. And I hope that we should be producing, as soon as I click go on here, let's watch this go through the system. So out comes the raw product. It's going to go into the dissolver to be reduced in concentration by 1, and we'll see what comes out the other end. Let's just pause that a second. There we go. So it's turned into defamsin solution. You can see now that we're at the proper concentration to activate the treating diabetes cure, but we still obviously have the pins and needles. We're at concentration 5. We need to reduce it by 1 more to get it into the 3 and 4 range so we can remove the pins and needles. So let's go through the system again. Goes on the conveyor belts. Get ready to pause the game. And out comes a new product now. This is defammin solution. So the first one, if you remember, was the same thing, only this time it's weaker, less concentration. You can see now that there's a tick next to the 3 and 4 on the pre-requirements. So now if we go through another dissolver, we will be removing the causes, pins and needles side effect, but keeping the diabetes. And we're still in the active range for the diabetes. So let's do that again. So you can see that goes through the system again. More dissolving going on. Get ready to pause once it comes out the other side. Boom. And this is what we come up with. So a rendonolic extract. It's a concentration 3. It will treat diabetes. No other poor side effects in there at all. So hopefully we'll be able to get these into the pill makers and start producing some pills. Let's have a look. So that one's going to go in that end. Hopefully that's going to go along to the end, and it is. Now both are pills, and what we're producing is this little tablet here, rendolic pill. That's what it looks like. And at the moment, because we're using a pill maker, it increases the combined value by $20. So the profit per tablet is going to be $40, which is good, not bad. And hopefully these are going to go out to sell. There they go. A new name is going to be required.
Product name required.
So now we've got to name this drug. So what are we going to call this? Well, I'm going to call it diabetes. Now I could do E's like that, I suppose, but diabetes. We use the Z. We're going to be flash. So this is the diabetes drug. Name and go. And now that should be selling at 125 per pill, and you can see where those are going out the door. Now if we go over to our company screen, straight off the bat we look for V4V Chems. Here we go. This is our new drug, diabetes. Treats diabetes. It's got a Q rating of C, which is not good, not bad, just in the middle really. We've sold 5 so far at 125, making $40 per tablet. So profit 40, about 200. That means that we've got a plus 10 here. Okay. And if we look at our research, that's because our researching guy costs us £30 a day, and we're selling obviously a profit of 10 because we're selling a profit of 40. So he's now at 57%. Excellent. So that's that done. Now we could potentially look at turning this into a hyperthyroidism drug as well. Now in order for us to do that, let's have a look at this. Using the same, this is the same process, okay? We don't necessarily have to import more goods. What we have to do is take this particular drug and get it to, and basically get it to 10, which is quite a lot. Now we have, in terms of basics, we can only do it by 1. We would have to have 9 evaporators to get this drug up to yeah, well, we'd need 7 to get it to 10, and then we'd need an ionizer, which we don't have yet. So actually we can't do an awful lot with it. Let's have a look though at our other drug. This is the hypertension over here, and yeah, it's coming in at 14, at a strength of 14. Let's go back to our production. I think we should buy this piece of land. There we go. So now we have a bigger factory to work with, alright? Let's have a look at importing in some of this other stuff, this bruised meso quartz. Let's import that. Okay, so we can see it here. It's going to come in at 14. We need it to be active between 9 and 13, so it's almost active. However, it will cause fatigue. In order to reduce it, we've got to get it from 14 to 5. So we need to reduce it by 9. Now, ordinarily, if we were using something like an ionizer, we would use 3 of those to do that, or we could autoclave it and halve it. But we don't have that at the moment. The only thing we have is this. So let's have a go at seeing what we can do here. So 1, 2, 3, 4. Okay, remember we need an output to be able to sell this drug. Okay, so 4, 5, 6, 7. This is going to be a very expensive reduction. So 7 is going to take that down to 7. That's still not high enough. We can't put one there because it's going to be in the way, but we can put one around the corner. Oh no, we can't. Hold on, no we can't. Because again, your tracks are going to be in the way. So in order to move it, we can double click and pick it up. So they can't come out of there. We're going to need to move these one back. Like so. Because when we bring the belt down, you've got to have the belt on each side. So 1, 2, 3, 4, 5, 6, 7. Are we going to be able to do this? We could. 1, 2, 3, 4, 5, 6, 7, 8, and that will take us down to 1, 8. Take us to 5, which would be enough. So we would be able to remove it. Now, can we actually get rid of that? I didn't look at the necessary machine. We need an ionizer. We don't have that yet. So this is sort of in preparation for that. We need to begin the whole. But look, there we go. So this, if we send this drug through this system at least. Well, actually, let's go to our research. How much is an ionizer, and can we begin an ionizer? We need one more. So we're going to go into a bit of debt if we're not careful. How far are you away? 65. You're not far off, so let's just carry on going and get this drug through here, and you'll see what I mean. Although, we could probably get rid of all of these in a second, and you'll see why. So we're going to dissolve this down. We're going to see what comes out of these things. So, Proaphos tincture will take us down once more
A
to a
competitor
slightly
has
weaker
released a
concentration
new
of that.
product.
There's a world event. One of our competitors has released a new product, so she's cooperative sniffles buster. So I believe that's probably going to be. Let's have a look at research. Yeah, it soothes the cold symptoms. Now, that's quite advanced, so she's probably got some good stuff going on there. But she's obviously got different ingredients to us. That's not a competition to any of our drugs at the moment. Let's have a look at the stuff that's coming out here. So this is just Prophos tincture being weakened continually down. 9.
Research
This one's taken
complete.
8. But another event. Research complete. National headquarters is done. Let's take this guy now. Now we could go straight onto patents, but we need 2 for patents. I want to go straight onto the ionizer. We're going to need to get our basic tools. She doesn't. I don't think she has diabetes cures at the moment. So we're now down to Prophos tincture level 7. So actually, that's only to 6. It's not going to be enough. So we know that we're going to have the new one coming along. Probably shouldn't have bought all of these because we're going to waste a lot of them. Let's move them. Now I don't want to sell these because I've already bought them. But as this iron is the ionizer that's going to do this for us, isn't it? Let me just make sure. Oops, not the right thing. Ionizer decreases. So an ionizer is basically 3 of these. So all these ones that I've just bought, we're not really going to use. Well, we might still use them, to be fair.
Invalid position.
It's been connected to belts, alright. So much wastage. Because we are going to need to use these in the future, so just keeping them just means that we've bought them. We've bought them now, but it's okay. These are still going pretty good. It's at 125 still. Let's go and have a look at the cures and see how we're getting on with the diabetes cure. So you see 1,221. We're selling 30, meaning that we are meeting 37%. How much demand is being fulfilled decreases when above. So we're just over a third. Now we could have done another. We need 2, then, don't we? unfortunately we don't have enough of these outports, because if we'd had another outport we could have made another one of these to double the production, but as it happens, because there's only 3 ports left and we're going to need the ports in order to be able to make the hypertension drug, we can't. We could buy another plot of land here though and do another one maybe, although look, this doesn't only has 1 port in it again, and the port's really on the wrong side, but we could buy here. Shall we have a go? We know we need 3 of these for this, and 2 pill makers, that's all we need. So let's do that. Let's call in, again, some shimmering Mercrox crystals.
Insufficient
No, upgrade.
points.
Import. Keep hitting upgrade. Hit import. And then we're going to bring this down, all the way down to here somewhere. Then we're going to take some of our mistakenly bought goods. We need 3 of them for this, technically. Although in a minute we would be able to use an analyzer, ionizer, sorry. There we go, and then so 1, 2, 3, and then it should come out looking like this green stuff over here. So we're going to need 2 pill makers. 1 and 2.
Invalid
Oops,
position.
invalid placement. Get it right. There we go. And there. And there. So now we're going to be doubling. Hopefully in a second we'll be doubling once it goes through the system. And we're going to be making extra of the diabetes treatment, which will hopefully double our profits on that, because it's going to be still a $40 profit on here. And we have at least made use of some of those things there. So in they go, into the machines, out comes the tablet. And we're now making another line of the diabetes drugs, again at 125. And you'll see on our company chart list, that number's going to start creeping up. And the current value actually on this is 131, so we might be making 47 profit, yeah. That's because the drug rating, if you see here, it's gone from a C to a C+, and that's because the drug is considered to be safe, it's working, it's doing what it needs to do, there are no anti-side effects, so the sort of regulators, if you like, have said that this drug is at a C, but we don't know whether it's max strength. And that's important. The closer you get to max strength, the more money you can make for selling these things. But we don't know that yet. So there we go, we're now making this. All this bit of factory here is a bit wasted at the moment. There's a load of ports here, but we can't really do a lot with them at the minute. But you can see as well, we're now back into profit. So we are making good money selling diabetes drugs, which don't cause any nasty side effects and aren't killing anybody, which is a good thing. We've also got lots of these in stock, ready for
A
should need them.
competitor has released a new product.
New product here. Diabetes reliever. She is in direct competition to us. Now what that means really is we need to go to company. Let's pause this for a second. So she's now released. She has got the same drug as we have. She's got a C drug. It does the same. I don't know its strength, and I don't know, but she's only selling 4 at the moment. We're obviously making a big thing of our production. It's most of our money is coming. All of our money is coming from that, in fact. So let's go to research. What we now need to do really quickly is probably hire 2 of these, and I'm going to put them straight into patents. We need to patent our drug so that she can't sell it. She is selling an identical product, made almost certainly from the same product. It certainly looks the same colour. So it looks the same colour as ours. Maybe slightly greener, perhaps hers is one bit stronger than ours, maybe. But in any case, it's a tablet form diabetes cure. We have a tablet form diabetes cure. We want to protect that so she can't use hers. But to do that, we need to make a patent. I can tell you now, she's already probably working on hers, so we might end up losing the ability to sell this product very soon for up to a year. So we'll have to get that going. Hopefully research will be complete in a second.
Research complete.
Research is complete. There we go. There is the ionizer unlocked. Excellent. Let's pause this for now, because I think... Well, actually, we'll go to research and then we'll pause it. Fantastic. There we go. So we've made a start. Our little factory, V4V Chems, is now working. I hope you've enjoyed this video. If you have, please leave a like. If you want to leave any comments, leave them down below. And if you're not a subscriber to the channel yet, but you're thinking of subscribing, hit that button and come along for the druggy-induced journey. But until next time, from Big Pharma, you take care of yourselves. And I think next time we'll start using some of these ionizers and begin doing some of this hyperthyroid stuff as well. But until then, until next time, you take care of yourselves. You stay healthy. And I'll see you soon.